With so many health problems around us, I'm sure you must have heard of someone in your family or friend circle having either a stroke or a heart attack, and wondering to yourself if they're the same. A lot of people often get confused and use the terms interchangeably. Let me enlighten you on something. They are neither the same, nor are they synonyms. Although their symptoms and effects can be similar, strokes and heart attacks are two different medical problems, which affect completely different but vital parts of the body. Both are equally dangerous and life-threatening, and can also lead to disability and even death. A heart attack is the most common cause of death in the US, while stroke is the fifth most common cause of death in the US. In today's video, we will tell you the difference between a stroke and a heart attack, so that you know which is which the next time you hear about it. I hope we haven't scared you enough to run away, but before you do run away, don't forget to subscribe to Bestie and click the notification bell. Help support Bestie by watching this video until the end. Number 1. Affects different body parts. A heart attack happens when the arteries that supply blood to the heart become choked with fatty deposits called plaque. The plaque narrows and blocks the arteries. When pieces of plaque break free, blood clots can form, blocking the flow of blood to the heart. When that happens, the heart muscle does not get the oxygen and nutrients that it needs, and part of the heart may become damaged or die. This is what you call a heart attack, because it affects the heart. A stroke happens when the blood supply to the brain is interrupted, causing part of the brain to die. This is why you call it a stroke or brain attack. So you can say a stroke is similar to a heart attack, but it affects the blood vessels in the brain instead of the heart. The flow of blood to the brain may be blocked in the form of a clot. A stroke can also happen when a blood vessel in the brain bursts and bleeds, depriving an area of the brain blood and causing damage inside the brain. Pretty scary, isn't it? Number 2. Different causes. With our lifestyles getting unhealthier by the day, heart attacks have become quite common. There are certain factors of our day-to-day habits that can contribute to causing a heart attack. These can range from eating high-fat foods, lack of exercise, smoking, stress, excess weight, and drug use. You might be thinking that these things are things that I can control, and if I do, am I still at risk? The answer is yes. Apart from these factors, there are things such as age, family history, or hereditary and gender which can contribute to a heart attack. I guess it's time to find out more about your family history. Strokes are not as common as heart attacks but are still more frequent than other diseases. Just like heart disease, there are certain things which are under your control which cause a stroke. These are smoking, a diet high in fat and sodium, obesity, physical inactivity, heavy drinking, and high blood pressure. Let me make you sad again by telling you that even in the case of strokes, there are certain factors such as age, family history, race, and gender which can up your risk of a stroke. Didn't I tell you earlier knowing your family history would be a good idea? Number 3. Symptoms are different. Heart attacks can be fatal, but if identified and responded to quickly, the patients can likely be treated and saved. Some of the signs to look for in case of a heart attack are pain or ache in the chest or arms. This may even spread to your neck or back. Some other signs could be nausea, shortness of breath, and a cold sweat. Although the symptoms may vary in severity of pain, if you find these symptoms in someone, it's time to call the emergency services. The symptoms of a stroke are easier to identify as they're visible to the eye and can be recognized. These can be sudden numbness or weakness of the face, arm, or leg on one side of your body. You might also feel sudden confusion, trouble speaking, walking, or understanding. Respond as fast as you can if you notice any such symptom in yourself or someone that's around you. Number 4. Both are treated differently. Now you know that heart attacks and strokes are very different, so it makes sense that their treatments vary as well. In a heart attack, early treatment can prevent or limit damage to the heart muscle. Acting fast at the first symptoms of a heart attack can save you or your loved one's life. Medical personnel usually begin primary treatment before you even get to the hospital by giving you aspirin to prevent further blood clotting and another medicine for chest pain and to reduce your heart's workload and improve your blood flow. At the hospital, doctors use two main treatments to open blocked coronary arteries and restore blood flow through the blood vessels supplying the heart. They use clot-busting medicines and a procedure known as a coronary angioplasty to open blocked arteries. The three most important things here are timing, timing, and timing. A stroke is a medical emergency and the seconds count. I'm sure you'd be shocked to hear that brain cells begin to die within 4 minutes of the beginning of a stroke. Treatment depends on severity and type of stroke and focuses on restoring blood flow and on controlling bleeding and reducing pressure on the brain. The patient is given a clot-busting drug to dissolve the clot and help restore blood flow to the damaged area of the brain. But keep in mind, clot-busting drugs can only be given within the first few hours and are typically delivered intravenously. Other stroke treatments include surgery to remove blood from around the brain and repair damaged blood vessels, and also procedures used to improve blood flow in the brain's arteries and veins. Number 5. Which is worse? Now that you know all the differences between a heart attack and a stroke, the obvious questions are that both sound pretty horrible and scary, but which is worse? Well, for starters, you don't want to have a heart attack or stroke because both can lead to disability for life or even death. Now, coming back to the question. Both are evil, but the lesser of two evils would have to be the heart attack. If you go by statistics, heart attacks are more common and kill more people than strokes, but individuals may have more difficulty in life afterwards if they survive a stroke rather than if they survive the heart attack. A stroke can lead to life-altering disabilities, such as losing the ability to talk or to use certain parts of the body, for example, your right arm and right leg. But a heart attack usually does not lead to any of these things. Now that we've cleared up your confusion, we hope this video proves useful in the future in saving someone's life from a stroke or a heart attack. Now you know how different they are. Has any of your friends or family suffered a stroke or a heart attack in your presence? Let us know in the comments section below to continue the conversation and spread awareness. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of Bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.